Good morning. I'm Dan Hawkins, House Majority Leader of the Kansas House of Representatives, and today it is my pleasure to be joined by David Balat of the Texas Public Policy Foundation. You come a long way to be with us today.
I come a long way, but it's been worth it.
That's good. So David actually testified today in the Senate Public Health and Welfare Committee on Medicaid expansion. David has a lot of credentials in this area, and would you share with our viewers some of your credentials so they know where you're coming from?
Certainly. I grew up in the hospital industry, worked with the big hospital systems in Texas and Houston specifically, and then built a reputation as a hospital CEO that would turn around hospitals that were financially challenged, that needed some help, and we got them healthy again. Absolutely.
So David and I had a chance to sit down and speak this morning before he went to the Senate, and I found our conversation very, very helpful just from the fact that there's somebody else out there that has studied this whole Medicaid expansion system widely. David, one of the things that a lot of people say is that this is going to save rural healthcare, that it'll save rural hospitals. And you, in fact, came from the rural hospital setting. How does that work for rural hospitals? Is it really saving them?
It really isn't, because the Medicaid dollars still don't cover their costs. It's still a shortfall. So it really doesn't solve the problem. It doesn't fix it. And if you look at what's going on in this country, if you were to agree with that position, you look at California, and their Medi-Cal system covers 1 in 3 Californians. Yet in 2018, 10% of all hospital closures in this country were in California.
In California. And California actually, when you look at what's happened with their Medicaid expansion system, I think the last figure I saw was they were underwater about $50 million. Has that increased? Is that about where they're at?
Well, they're looking to expand it, so that's the trajectory. And you look at New York as well. It's been a significant impact to their budget, and they're scrambling to see what they have to do. And invariably, when you have that much of a government takeover of a healthcare system, you're going to have rationing, because there's not an unlimited pot of money.
And that was a great segue. So one of the things that I have talked to with a lot of people about this issue is the fact that they talk about access, that Medicaid expansion is going to increase access for these folks, and that it won't have any effect on any of the other populations. Has that been the case in your studies?
No, absolutely not. And, you know, let's put everything out on the table. There is a difference between health insurance and health care. When you hear a politician, Dan accepting, talk about health care, by and large, let that trigger something in your mind. They're talking about health insurance. I know Dan is probably the exception, because he's talking about direct primary care and other things that allow doctor and patient to come back together. We have a problem of too many middlemen in this country that are extracting a lot of value and a lot of resources from that relationship between the two parties that matter most. So we need to stop making those two things the same thing. They're absolutely not. When you look at Medicaid, the real problem across this country is the number of physicians that are enrolled in Medicaid. Very few physicians, as a percent of the number of physicians in the state, are actually enrolled. We already have a strain on the system. The people that are the most vulnerable, for which Medicaid was intended, have difficulty getting into a doctor. And when they get into a doctor, being able to find a specialist they may need is even more challenging. Expanding Medicaid is going to crowd those people out. And it's certainly not what we want to do. In Kansas, I was saying this in my testimony, you already have 37,000 children in Kansas, 5.1% of your population, that are already eligible for Medicaid, but they're unenrolled. For those that are suffering with a disability, you have 5,000 people on a waiting list waiting to get care. Now, that's just can care. What I really challenged the Senate committee to do is do the hard work to fix Medicaid. Don't look to expand something that's currently broken.
So that brings up another subject in my mind as you was talking. You know, there's an idea that if you have insurance or if you're on Medicaid, that automatically you're going to be healthier, that you're going to have better outcomes just because of that. Is that true?
Well, we're currently working on that research at the Texas Public Policy Foundation, and I was asked that question in the committee. I think the best indicator for health in a time when we've had more coverage under the ACA is life expectancy. For the first time in the history of this nation, we've seen a decrease in our life expectancy during a time when we've had more coverage. So I would unequivocally say that no, insurance or coverage, as I like to say, is not care. It's not going to help us get healthier just by having a card in our wallet.
Absolutely not. And of course, as you know, and I haven't said this to the listeners in all my videos, but a few years ago, Oregon did a study of their Medicaid system, and their study was to find out if there were better outcomes for those people who now were covered by Medicaid versus those who had no coverage whatsoever. Yeah. And they found out actually the opposite. Those people on Medicaid didn't have better outcomes. And that was actually an amazing study.
It was, and the results actually came out and said that having Medicaid was the equivalent of not having insurance at all.
Yeah, and you know, I have been dealing with the Medicaid system for, 7 years now. And our Medicaid system has problems. Now, we always try to make it better, right, but we have problems. This expansion is going to truly put, I believe, our Medicaid system into a tailspin.
Well, agreed. And I've never really understood the logic of we've got something that needs to be improved. It's currently broken. So let's just make it bigger.
Oh, absolutely. Make it larger.
It's just nonsensical to me. You know, fix the barn door first.
Yeah.
and make sure you're taking care of the people that are vulnerable. Fix what you have. Don't worry about expanding it. And many people that are you know, it was interesting. I heard some statements from Kansas Chamber that some of the other chambers that were coming in to testify said that this was a great opportunity for small employers to not offer benefits anymore and have people go on Medicaid. Well, you know what that's going to do to your budget because you haven't accounted for those.
No, absolutely not. And that's the one thing, you know, and you know this, people don't really like to talk about the cost anymore. I've harped on the cost over and over and over, and I think it just falls on deaf ears for the most part. But the cost is ballooning across the nation.
It is. Not
just for the states, but also for our federal government. Their costs are going out of sight for Medicaid. So at some point, they have to make a decision. Are they going to stick with the enhanced match, or are they going to move back to what we call FMAP and truly put us in a budget crisis?
On the federal level, Medicare, Medicaid, Social Security, and the interest on the debt is the majority of our budget.
Absolutely.
So what's left in discretionary is very, very small amount, and you have to cover the military in that number.
Sure. So we're going to finish up. Is there any other pearls of wisdom? I've run out of questions. Actually, I could ask you questions all day. But is there any pearl of wisdom you want to leave with our listeners before we end up?
Be engaged. I know healthcare is complex. I know it's hard to understand. But you've got great thought leaders here in the state of Kansas. You've got friends in Texas that you can lean on as well. But getting in when things are at this point in time sometimes could be too late. I hope that's not the case today, but I would encourage you all to be engaged at every point. Elections have consequences and they matter. And we need leaders that will understand what is best for the long-term health of your state, my state, and for this country.
Well, thank you, David, for being with us today. I know that you and I will stay in touch.
Absolutely.
So I feel like I've made a friend here. We just met this morning, but we're kind of kindred spirit. We both are trying to do the same thing. And I wish you luck in Texas. And listeners, stay tuned. We'll have more opportunities to have people just like David on our videos. Thank you.
Thank you.